Hi everybody, this is Penny Zoll, and this is the introductory portion of the acid-base imbalances learning plan. Okay, so what does acid-base mean? Well, really, it is measured on a pH scale, and that is what acid-base is a measurement of the body's pH. So then, what is a pH scale? That, simply put, is a measurement of the body fluid's free hydrogen ion levels. As you may already know, the pH scale actually ranges from 1 to 14. However, our body has a very tight range, and so the normal pH for our arterial blood is 7.35 to 7.45. And you'll notice there are no labels following those numbers because actually the free hydrogen ion level of our blood is so low compared with electrolytes. You know how electrolytes are calculated, say milliequivalents per liter. The pH is calculated actually using a negative logarithm of the concentration. So because it's the negative logarithm, the level of free hydrogen ions in the blood is actually inversely related to the pH. So in other words, the lower the pH value of a fluid, the higher the level of free hydrogen ions in that fluid. It'd be acidic. Conversely, the higher the pH value of the fluid, the lower the free hydrogen ions of that fluid, and that would be alkalytic. And you may be asking yourself, why is this even important? Well, it actually is, and that's why we've decided to include it in the curriculum, and it will be included in your state boards as well, because the pH of the body fluids affects a lot of things. It affects some of listed here, enzyme and hormone activity. It affects fluid and electrolyte balance. We kind of touched on that earlier. It does affect the excitable membrane function and some drug effectiveness. So let's get right into talking about acids and bases. First, we'll talk about acids. Acids are substances that actually release hydrogen ions in water. Because they release hydrogen ions in water, the more acids that are present, there will be more free hydrogen ions. And the more free hydrogen ions, the more acidic the body fluid becomes. The more acidic becomes, which is called acidosis, the lower the pH because of that inverse relationship. An example of a strong acid is hydrochloric acid. This is considered a strong acid because it easily disassociates in water. An example of a weaker acid would be one that maybe does not disassociate very well, or that doesn't have a lot of hydrogen ions to release. Okay, so bases. Bases actually bind free hydrogen ions in water. And in fact, Iggy refers to bases as hydrogen ion acceptors on page 200. So it stands to reason that if there's more base present, there will be less free hydrogen ions. And if there's less free hydrogen ions, that's called alkalosis, the pH will go up because of the inverse relationship. Some examples of strong bases are sodium hydroxide and ammonia. They're considered strong because they bind hydrogen ions more readily or easily. Bicarbonate, HCO3, is a weak base, but it prevents some major changes in the body. We're going to talk about bicarbonate next. Okay, so the most common base is bicarbonate, or it'll be referred to as bicarb. It is a weak base, but it's very important in physiology. the weak base, even though it is weak, it does bind with hydrogen ions. That's why it's called a base. Our most common acid is H2CO3, which is carbonic acid. It's a very strong acid. It releases hydrogen ions easily in water. And because carbonic acid is so strong and bicarb is a weaker base, the ratio of carbonic acid to bicarb needs to be 1 to 20. 1 molecule of carbonic acid for every 20 molecules of bicarb. When it comes to maintaining the pH in the normal zone, a key concept to understand is this carbonic anhydrase equation. Basically, this demonstrates that when carbon dioxide and water are combined, it forms carbonic acid. However, as soon as the carbonic acid is formed, it immediately separates into free hydrogen ions and bicarbonate ions, or bicarb ions. So this equation can go in either direction. So the more carbon dioxide that we have that's combined with water in our system is directly related to how many free hydrogen ions we have. Or if we have excessive hydrogen ions, the equation will work to the left and it'll produce extra carbon dioxide. So there is a strong relationship between hydrogen ions and carbon dioxide. Okay, so now we're just going to look at some of the components in this carbonic anhydrase equation. We'll start with the bicarbonate. Bicarbonate ions, where do we get them from? Well, as you can see from this formula, we get them from the breakdown of carbonic acid. They're also absorbed in the GI tract. Bicarb is also produced by the pancreas. And it can also be moved from the cells into the extracellular fluid. And our kidneys can actually have a part of reabsorbing bicarb as well. So all those systems can work together to maintain the adequate amount of bicarb. And basically, what is bicarb for? Well, again, it is a base and it's to soak up or accept hydrogen ions. Okay, now that we've considered bicarb, let's consider carbonic acid, H2CO3, here in the middle. Well, where do we get it from? Well, you can easily see, looking at this formula, that when carbon dioxide combines with water, carbonic acid is formed. You probably know already that carbon dioxide is actually a byproduct of carbohydrate metabolism, and that is where the carbon dioxide comes from. So what is carbonic acid for? Well, it is an acid, again, because it releases the hydrogen ion, and it's a strong acid. Okay, let's look a little more closely at that relationship I talked about before between carbon dioxide and hydrogen ion. Carbon dioxide is an acid, and the body can get rid of easily by breathing. As you know, when we exhale, we get rid of carbon dioxide. So it is the fastest way to get rid of acid and for the body to change its pH. So keeping that in mind, if you were to hold your breath right now, what would that do to your acid levels in the blood? Well, if you held your breath and you're not releasing carbon dioxide, your free hydrogen ions would increase in your system, and your pH after a time would actually go down, right? How about hyperventilation? If you were to breathe rapidly and deeply, you would be excreting a lot of carbon dioxide, and you would have less circulating hydrogen ions in your blood. And because of that, your pH would go up. Okay, just to reinforce what I just described in the previous slide, if our carbon dioxide level in the blood goes up, because of the inverse relationship with hydrogen ions, our pH will go down, this acidosis. Conversely, if our carbon dioxide level in the blood goes down, our pH comes up, and that's called alkalosis. So keeping this in mind, why is it sometimes we have people breathe into a paper bag when they hyperventilate? Well, it's because when they're hyperventilating, they're blowing off too much CO2, and their pH is going up. They're in respiratory alkalosis, and we'll talk about those conditions later. But by having them breathe into a paper bag, they actually inhale more carbon dioxide, and it reverses their pH. And I'd like to just touch briefly about other acids besides CO2 that we do have in our bodies and where they come from. Well, through the Krebs cycle I already talked about is production of acids through metabolism. Well, there's also catabolism of fat and proteins that will produce sulfuric acid and your fatty and keto acids. And also anaerobic metabolism, which I'm sure you know that means without oxygen, will produce lactic acid. And cellular damage or breakdown of cells will actually release acid into the system. So to maintain homeostasis, we really have to get rid of excess acids. So there are sources of other acids, and those acids produce or release hydrogen ions, and our body must maintain the pH between 7.35 and 7.45. Therefore, even though hydrogen ion concentration is consistent, it cannot be excessive. Our carbon dioxide loss has to keep up with the hydrogen ion production. Keeping in mind that the ideal ratio of carbonic acid to bicarbonate must be what? Must be 1 to 20. The ratio of carbonic acid to bicarbonate must be maintained at 1 to 20. So how does our body keep our acids and base within range? Well, there are three primary regulatory mechanisms, and the first is the chemical buffers, which is the first line of defense. Second line of defense is respiratory, followed by the renal regulatory mechanism. And another way to look at it here, this demonstrates that the first line of defense is the chemical reactions or buffers, second respiratory, and thirdly renal. So what is the chemical control of acid base? Well, that is managed through something called buffers. And Iggy addresses buffers on page 202, but basically they're substances that can either release hydrogen ions or bind hydrogen ions depending on the need. So buffers react depending on what's actually needed to make the fluid more acidic or basic, which means alkalytic, depending on what's needed. This table here is taken directly from your book, page 200, and it demonstrates a function, one of the functions of a buffer. This example actually shows a situation where the base component outnumbers the acid component, and a buffer is added into that alkaline fluid, or basic fluid if you will, and actually releases a hydrogen ion to maintain homeostasis. And of course the opposite would be true if the acidic component outnumbered the base component, the buffer would be added to the acidic fluid to actually soak up excess hydrogen ions to maintain the pH between 7.35 and 7.45. In your book, it does talk about various types of buffers. They seem to range from albumin, hemoglobin. Let's see, the two most common though are phosphate and, guess what, bicarbonate. So bicarbonate production and regulation is very important. Okay, so the respiratory mechanisms is our second line of defense to regulate and maintain homeostasis with the pH. And we touched on this before, and we're going to look at it just for the next 3 slides. And so my question to you, with hyperventilation, what happens to the pH when respiratory rate and or depth increase? I want you to think that through. Remember that the pH is inversely proportional to hydrogen ions. So when the respiratory rate increases or the depth increases, more carbon dioxide is being blown off, which means hydrogen ion concentrations go down and pH goes up. The person becomes more basic or alkalytic. Conversely, with hypoventilation, what happens to the pH when the respiratory rate decreases or becomes shallow for some reason? Okay, if the respiratory rate decreases or becomes shallow, that person will retain excessive CO2, which means a hydrogen ion concentration goes up and the pH inversely goes down. That's called acidosis. So as I said before, respirations is a second line of defense when the chemical mechanisms don't work effectively enough to regulate the pH. So basically this is what happens. If the pH in the blood is decreasing, the chemoreceptors in the brain stimulate the neurotransmitters to increase the speed and depth of respirations. It's a feedback loop. Inversely, if there's increasing pH in the blood, that means a person's becoming alkalinic, going in alkalosis. Chemoreceptors in the brain inhibit the stimulation of neurotransmitters. So, therefore, the depth and rate of the respirations are actually decreased. So, more carbon dioxide will be retained. Okay, I took this also from a little diagram they have on page 203 in IGGY. They kind of have it overlaid on a picture of a brain. But I thought it really explained that previous slide well. For instance, right now, if all of us were to hold our breath and then begin, breathing very slowly, shallow breaths, we would be increasing the carbon dioxide or partial pressure of carbon dioxide in our blood, which, as you know, is directly related to hydrogen ions increasing. Because of that, the chemoreceptors in our brain are stimulated and our respiration rate and depth is increased. That in turn will cause a decrease in the partial pressure of carbon dioxide and decrease, of course, the hydrogen ion concentration. That would inhibit the chemoreceptors, which would cause a decrease in rate and depth of respiration. So there is a feedback loop there. Okay, and finally the third line of defense is renal or kidney compensation. It does take about 24 to 48 hours for the kidneys to compensate. So it usually occurs when blood pH changes are persistent. The primary way that the renal system compensates is by what it does with bicarbonate and with hydrogen ions, but mostly with bicarbonate. So as you can see here, healthy kidneys can actually increase the reabsorption of bicarb in a situation where there would be acidosis going on, too much hydrogen ion. They can actually reabsorb bicarbonate, or they can increase the excretion of bicarb in the case of alkalosis. And actually, the kidney tubules can make additional bicarbonate that will be absorbed when excessive hydrogen ions are present. And the kidneys can even excrete excess hydrogen ions. So it's an efficient system, but it takes longer. Before in this introduction portion of this presentation, I just want to consider some age-related changes with older adults in particular. Many times the elderly are less able to respond to pH changes. This is for a variety of reasons. Many times they have less alveolar membrane for gas exchange or vessel thickening, especially if they have concurrent health issues, respiratory in particular. If there's a decrease in kidney function, you can imagine that a lot of the regulatory systems might be affected. Medications that they're on, especially those involving fluid and electrolytes, will affect their pH. And basically, they're just at a greater risk with their underlying illnesses, whether it's any of these that are listed. So keep in mind that sometimes when they have an altered pH, they take a little longer to respond and get back into that very narrow range of normal. So how can we tell what a person's pH range is, or their acid-base level? Well, there are certainly signs and symptoms that we will be exploring and that Iggy describes in chapter 14. But one of the easiest ways is by looking at the lab parameters of arterial blood gases. This is a blood sample that is drawn from a person's artery, and it is a measurement of the relative hydrogen ion concentration. So the next slide shows the normal values for ABGs. Okay, so here is just a quick view of the normal ABG values. We've already discussed that pH that's the label, that's the inverse relationship to hydrogen ions, and again it's a very tight range of 7.35 to 7.45. The PaO2, or sometimes, many times you'll see it referred to as PO2, that's simply the pressure that the oxygen exerts in the blood, or the tension. And the normal for that is 80 to 100. The label is millimeters mercury, but it's important to remember 80 to 100. The PaCO2, or the partial pressure of carbon dioxide in the blood, 35 to 45. Okay, and of course it has to do with our respiratory system. And then our bicarbonate, which is very much related to the renal system, is measured in milliequivalents per liter, and the number is 22 to 26 is normal. I want you to memorize these values, not only for the test, not only for state boards, but if you work in acute care, you will be using these consistently. And they're very telling. Even in clinical, I'd like you to start looking at ABG values and start interpreting what's going on with your client. The last value that are jotted down here is the O2 saturation. That's something that's always good to monitor in your clients who may have acid-base disturbance. As you know, we use a finger probe to get an indirect O2 saturation, and that simply indicates the amount of hemoglobin that is saturated with oxygen. And normal, as you know, is 95 or greater for a healthy individual. So this is the end of this portion of the presentation. The next portion, I'm going to begin actually with this slide to review the normals again, and we'll talk about signs and symptoms of clients in respiratory metabolic acidosis, and then those in respiratory and metabolic alkalosis, and of course nursing approach to their care. And then in class, I think we'll take some time to do some problems, work out some acid-base interpretation questions. Before that, though, I'd like you to look on Blackboard because I put a couple of pretty nice study aids in there. The first one is one that Marty Timken developed, and it is a study guide with various questions. Some of them relate to fluid and electrolytes, which you may appreciate or may not. And but a lot of them, of course, relate to acid-base, and there are some ABG interpretations in there. I would like you to read the article that I posted on Blackboard called Turning ABGs into Child Play. It's a wonderful article that does actually make the process so much easier. Then if you look on Blackboard, Connie Lindmeyer actually has developed a pack, worksheets, I guess you could say a study pack that you can read through and listen to her voiceover at the same time. And she goes through, I think, 4 or 5 clients using that same model, that tic-tac-toe model that's presented in that article on Blackboard, to interpret ABGs and to talk about, you know, various perhaps interventions, but it does focus primarily on interpretation, which is something that sometimes is a little challenging to get your mind around. So take a look at Connie's and Marty's works on Blackboard, and I really appreciate them letting us use them because I know they put a lot of work into them. And then in class, we'll do a few more practice questions, okay? So I will see you all later. Goodbye.